السلام عليكم ورحمة الله. My voice clear?
عليكم السلام ورحمة الله.
السلام ورحمة الله. السلام ورحمة الله.
Okay, let's start. Okay, we'll start here. Any Irish candidate or only UK? All UK?
Irish هنا يا باشا.
Okay, because I will, if Irish, I will do for Irish and UK. So I will start by UK, inshallah. Are you following me?
Yes, Dr. Talal.
Okay. So in UK we have 5 stations. Station from 1 to 5. Station 1, which is communication and respiratory. Every station it will be in the same room. Every one is 10 minutes, so total 20 minutes, and then 5 minutes in between. Number 2 is long clinical consultation. 3, cardiovascular and neuro. 4, communication and abdomen. 5, long clinical consultation. Total mark is 168. So now I will show you how they are doing marking for the skill and what are the skill you are examined for. I will share this. Concentrate with this because for every station there is 2 examiner. They will give you 2 paper for this. This is for long clinical consultation. I will explain on this because it contain all the skills. Okay. You write your name in the beginning by the normal maneuver you are doing, like putting your pencil on the numbers here. Okay. For example, your code is 134. You will do 1 here, and the next column will be 3, and the third column will be 4. Okay. So I will start as if you are in long clinical consultation. First skill is clinical communication skills. This paper, it will be with you and you will give it to the examiner, but during the exam, you have no time to read it. Definitely no one is looking at it. But it's very important because how he is giving you the score. So here, the things they want you to do is to elicit appropriate and comprehensive history, okay? And assess the impaction. We said impaction. If you did not said how this impact you about your job and daily activity will affect you, and explain the clinical information in a clear, structured, comprehensive manner. Every skill equal 4 mark. If he give you satisfactory, if borderline, it will be 2. If unsatisfactory, will be 0. Okay. So there is 2 examiner. If one give you satisfactory and the other one give you satisfactory, means 8 in this skill divided by 2, it will be 4. If one gave you borderline, for example, and the other one give you satisfactory, 4 plus 2 divided 2, it will be 3. Okay. Are you following me?
Yeah. It means if unsatisfactory, the mark will be
Yes,
2
sir.
for which one of the examiner?
No, I will explain it. It's in another way. Just do it. Now we said if you fulfill this criteria, he will give you satisfactory. If you omit important area in the history, for example, you did not ask about family history, surgical history, which is important in your case. You did not ask about how much this impact in your daily activity. If you did not ask about if you use jargon, for example, or you are being hesitant, unpracticed, unprepared, you are jumping from one system to another system. If the examiner see you that you will take unsatisfactory, means you'll take 0 in this skill. Now I am taking it skill by skill to understand. Okay. Marking in UK different in Irish. In Irish, only one examiner. In UK, now when you are in UK, then I will go to Irish. Here we have 2 examiner in the session. Okay. For example, one gave you in this skill, which is clinical communication skill. One gave you satisfactory, means he gave you 4 mark. The other one gave you satisfactory, means also 4 mark. They are taking the sum of these marks and divide by 2. 4 plus 4 equal 8. Divided by 2, it will be 4. So your skill here, skill mark is 4. If one give you borderline, this means he gave you 2. The other one gave you 4, means 4 plus 2 equals 6. Divided by 2, so skill mark, your skill mark in this station is 3. You got the idea?
Yes, Dr.
Yes, we got it. Yes.
Okay. Clinical communication skill present in the talkative stations. I mean, it's present in 2 long clinical consultation and present in the 2 communication. This means it will be the total mark of cam 16. Okay, 16. Take care. It will be 16 because it's not present in the short station. 4 in long clinical consultation, and in divided in multiply in 2, it will be 8, and the other 2 communication will be 8. The problem here, the pass mark in this station is, in this skill is 11. 11 out of 16. This means if you got unsatisfactory of one skill, you will be at risk. Why? Because you now have 12 marks to get from the other 3 station. You got my point?
Yes.
So how you will take the mark of this skill? By practice. Practice with your friend, practice under supervision. You must be prepared, you must be systematic. Don't jump from system to system. Cover all the history, as we mentioned, 3 part: current history and present history, and analysis of the complaint, past history, and impaction. Finish this skill. Any question in this skill?
No.
I want you to be interactive with me to sure that you understand the idea.
Sorry, Dr. Talat. Written in the second in clinical communication skill, assess impact of symptoms and identifies patient's preferred management options.
Yes,
I
because
don't know, but may it will not be in all. Yeah, I will involve the patient in the management option.
Yes, this is a part of autonomy. The patient has the right to decide or refuse his medication. For example, you said them, I will give you warfarin or apixaban. You explain what is the benefit of this and what is the benefit of this and disadvantage of everyone. He will tell you, I have no time to come to the hospital to check for INR and blood, so I will go for apixaban. You got my point? You involve the patient in management plan simply.
Yes.
Dr. Ahmad, when you will do a practice of communication, it will be very easy to understand these points.
Okay.
Then we will go for the other one, which is physical. Now managing patient concern. Oh, okay. We will go for physical examination. We will go by arrangement. You are in long clinical consultation now. You finish history. Now you will go for examination. Physical examination, they want you to do the technique correct. And it will be also professional. Don't appear in front of the examiner that you are hesitant. If you will do so, you will take satisfactory. If you omit important symptoms or important examination, for example, you are in a cardio case and you did not examine the pulse, or you did it in correct technique, especially percussion, especially in females, they are not doing percussion well. They are not using the wrist, they are using the fingers. If you are unsystematic or hesitant, this will give you unsatisfactory. And the marking will be the same. Satisfactory equal 4, unsatisfactory equal 0, borderline equal 2. Okay, physical examination present in all station except the communication. So it will be total mark 24. Pass mark, it will be 16. 16. If you got unsatisfactory in 2 station, you will be at risk. Any question in this skill?
No.
Hello?
The most
No.
clear skill, I think. This is the most clear, the physical examination and the history taking. I think for us.
Yes, this will be after history taking. You will do physical examination. Should be professional. That's why this skill is very easy to get by practice. You will do practice with your friend, your brother. Watch yourself making video for yourself and watch it again. It will make it simple for you to know where is your mistake. Physical examination, you should at least 24, 23 mark in your hand simply, because only what you are doing is that he's observing the technique. Now I'm not focusing what you elicit sign. You did, for example, abdominal examination, start by the hand. You did the lower them and look for the palm, and then go up for searching for fistula, and then neck, and so on. You did it correctly, you will be satisfactory. Okay. Now I am walking. I'm not jumping. I'm walking as if you are in long clinical consultation, just to understand the idea. Then after physical examination, and also to fix the approach for a long clinical consultation. Then you will fix what? You will ask the patient what is your concern. Okay. We said before you have at least 2 minutes. When you hear 2 minutes remaining, leave everything and ask what is your concern. So this should be in clear layman words, should be understandable. The patient should understand what you are telling. Don't tell him, for example, medical abbreviation, or don't tell him jargons. It should be easy. Okay. And should answer the concern, whatever the concern is. Overlooking the concern, ignoring the patient concern is equal unsatisfactory. Okay. Even if you said to the patient, I will answer your concern later. After finishing what you are doing, again ask, return to the patient and answer his concern. This skill also easy because as if you are a good listener to the patient. Whatever concern he's asking, you answer. So this present in the two long and in the two communication. So 4 in 4 equals 16. And the pass mark is 10. This skill also easy, should be collected. So now we said physical examination 24, easy. Clinical communication skill by good history, 16 mark, easy. Managing patient concern, 16 mark, easy. Last skill, which is maintaining patient welfare. You should be gentle to the patient, treat him politely, respectively. Even if you are talking in communication or long, don't make any emotional discomfort, it will be satisfactory. And when you do anything to the patient, for example, you are doing any maneuver, you should explain to him or quickly tell him that I will do. Don't make surprise for him for putting your hand in his tummy, or go in back of the patient to examine his thyroid without telling him that I will go in your behind you. Okay. This is 32 mark, considered as a gift, because the majority of patients, even who fail the exam, will take 32 out of 32, and the pass mark is 28. And this skill also very dangerous, because some examiner, if you did any physical harm, and this skill will be unsatisfactory, sometimes they failing you all the station. It happened with some doctor. He did upgoing plantar and they make painful to the patient, and she drag her leg, and he give him 0 out of 20 in neuro case. So take care of this skill. 32 in your hand easily, or you will lose the station.
معلش يا دكتور طلعت، هي دي ال 32 الدرجه بتاعتها والنجاح فيها من كام؟
28.
السكسس هاو ماتش؟ 28 بس.
معلش يا دكتور
Managing
طلعت، هو الكانديديت عملت
manage
ايه؟ خد زيرو.
he asked the patient, he did not ask the patient that I will do Babinski sign for the neuro case. He did it without taking permission, and he did it aggressively, and the patient said, he left his leg. That's why he gave him not only unsatisfactory in the skill, he gave him 0 out of 20. Okay.
Okay.
This skill present in all 8 stations. You got my point?
Yes, yes.
Okay. Now, after that, the most difficult skills are coming now. Identifying physical signs, differential diagnosis, and the clinical judgment. Why? Because the previous 88 mark, if you are practicing well, either examination or taking history, and you are good listener for concern of the patient, and you are very gentle with the patient and respectful to the patient, you will take the full mark. Now, the problem, identifying physical sign, differential diagnosis, because it will depend on your sign you got, and the clinical judgment. So if you start wrong, it will continue wrong. For example, your case, renal transplant, okay, and there is mass, and you said, for example, this is hepatomegaly. The examiner will continue with you in the question related to what you said. That's why it's very, now is start the risk here. Identify a physical sign, satisfactory, you have to identify physical sign. Nothing else. You have to identify correct physical signs. And unsatisfactory if you did not identify important sign or you invent a sign. This is catastrophe if you did not see a sign and you said, for example, this patient has jaundice and he don't have jaundice. Inventing a sign, definitely you may fail the skill, even يعني, others are correct. Identifying physical signs, this will be present in all skill except communication skill. So it will be the total mark of the skill 24, and alhamdulillah the pass mark is 14. You have some area to miss. Any question in this skill? Are you following me, brothers?
Yes, yes, yes.
This is
Yes,
clear.
Yes.
Okay.
Yes, doctor.
Okay.
So
Okay.
it was considered the combination for the physical examination, but the physical signs for the diagnosis of the case. And it is also
Yes.
concluded the physical examination. I will not sense of it while doing. I am doing the examination right, so I will sure got the signs, but it needs I think training to get it.
Now we started in the last 3 skill. I left because this is the start of the discussion. First skills you will do, he observe. Okay. He's observing this. Now we start physical examination, identify physical sign, and the others the same will be in the short. Okay. That's why I took the long, because it involve all the skills. So the examiner watching you physical examination, you are doing the technique correctly, but he don't know if you are, for example, you are listening for the heart, but I don't know what you are getting. Is there any murmur, or you will tell me it's normal? Okay, this will be in physical sign. You said there is systolic murmur and there is no murmur. This is inventing sign equal fail of the skill. That's why this the skill is the most dangerous skill. Identify physical sign, because what will be next, it will be depend on this skill. You will say identify physical sign, there is jaundice and the case is renal transplant, definitely you will put in your differential, which will coming next. You will put chronic liver disease and hemolytic anemia and so on, although the condition is, the case is renal. And definitely the clinical judgment will be depend on the sign you got, which is diagnosis, which was chronic liver disease, and it will be wrong. That's why the risk is here and the problem is here. Then we will go to differential diagnosis.
If in the physical sign, for example, if we invent any sign which is not present, so in that particular station, the examiner, both examiner will give unsatisfactory. It means we in that particular station, it will be 0 for physical sign.
Yes. Yes.
But still there are chances that we
Yes,
we can pass the exam. If
that's
we
what I told you. You can pass even if you took concentrate with me. Even if you took unsatisfactory in 2 station and borderline in another station, 3,
Yes.
you still have a chance. Why? Because the pass mark is 14 out of 24. You got the idea?
Yes.
You got unsatisfactory, you lost 4. You got another unsatisfactory, you lost 4. Okay? And then you got borderline. Now you got 14 out of 24 bust.
Yes.
That's why, because this skill is difficult, I think they made the pass mark a little bit lower. Then we will go to differential diagnosis. You should give a sensible, reasonable differential diagnosis, including correct diagnosis. It's not logic to say, unless if the case is very difficult, they may pass it. Don't focus so much. If the case, but if the case is straightforward and easy, there is click and it's dual valve replacement, 2 click are here, and you are telling another thing else, this will not be good.
Sometimes
Fail
there
to
is
consider.
sometimes the case is very straightforward. So in
If
that
it's
case, we
straightforward,
also have to give differential also.
you should, yes, you should give differential. Differential, we mentioned before, you will give differential according to the case itself. For example, aortic stenosis, you will give aortic sclerosis, Hockham, Williams syndrome, and so on. Or there is pansystolic murmur, so I will give also differential diagnosis of pansystolic murmur. I will add, for example, mitral regurg against that, blah blah blah, or VCD against that, blah blah blah. You got the idea? Either the sign you pick or the disease itself. These are the differential diagnosis you are giving to the examiner. Okay.
Okay.
Last skill is clinical judgment. Clinical
Sorry, what
judgment.
is the passing marks in differential?
Differential diagnosis passing mark. Sorry. The total mark of differential present in all station except the 2 communication. So it will be 24. The total mark. Passing mark is 15. 15. So if you got 2 unsatisfactory in 2 station, still only 1 mark. Otherwise, you'll be at risk. Okay.
Yes, yes.
Then last one is clinical judgment. Clinical judgment, you have to. This is management plan, which is investigation and treatment. You should give him accurate and appropriate clinical knowledge to the management plan, either for investigation or for the treatment. Okay.
Yes.
If you fail of this, definitely you will be away. As we mentioned, this will depend on physical sign and will depend on differential diagnosis. If you are going in the wrong direction from the beginning, definitely you will continue wrong. He will not stop the discussion. He will ask. He will not tell you that you are wrong, doctor. There is no jaundice. There is renal transplant, and why you are going. No, he will never correct you. You will go for jaundice. I will complete my question for jaundice, and the differential diagnosis will be for it. Okay.
Yes.
So now
What
in
is
this
the pass
skill,
marks here? The clinical judgment pass marks?
yes, I will tell doctor. This clinical judgment is present in all, even in the communications, there is clinical judgment. So present in all stations, it will be 32. And alhamdulillah, pass mark is 20. 20. So you have 3 stations to be unsatisfactory to us. You got the idea? Even if you
Yeah.
got unsatisfactory in 3. So alhamdulillah, the most difficult skills have the lowest rate of pass mark. This is the best thing in this. Quickly in Irish, it will be the same, but for long. But in Irish, it's the total mark of 18. Patient concern and clinical communication skill, every one equal 4. Okay, and the others equal 2 for every skill equal 2. So 4 plus 4 plus the 5 2, it will be 18. And if you got for the 2 which are for clinical communication or managing patient concern borderline, it will be 2. Unsatisfactory, it will be 0. Okay. Same skills in the physical examination. Now I am in Irish. Physical examination, identifying physical sign, differential diagnosis, clinical judgment, patient welfare in short station, everyone equal 2. So the total in the short it will be 10. Okay, in communication there will be 2 skill, which is communication 4, and managing patient concern 4, so now 8, and the clinical judgment, okay, and patient welfare 2. So the communication station in Irish equal 12. Okay, the skill in Irish quickly: clinical communication skill 8, the passmark 8 out of 12. Managing patient relationship 8 out of 12. Physical examination 8 out of 12. Identifying physical sign 8 out of 12. Differential diagnosis also 8 out of 12. Clinical judgment 10 out of 14. Managing patient safety, which is welfare, is 12 out of 14. Okay, but there is different point in Irish. You should pass at least one long out of, you have two long cases, you should at least pass one long plus 3 of the short, plus passing all the 7 skill. Okay, the short in the Irish communication, abdomen is fixed, either respiratory or cardio, either neuro or locomotor, either endo or miscellaneous. Okay, any Irish candidate want to ask any question? Okay, the pass mark sometimes it change in Irish, not fixed. The pass mark of the exam 68 out of 88, sometimes 69, sometimes 70. Even the skill itself sometimes change depending on the diet. Sometimes if a difficult case and station, instead of the pass mark 8 out of 12, it will be 7 out of 12, but not less than 7. Okay, any question at that point? You are not with me. Where is that?
Yes, thank you.
Okay, any question at the time, at this point?
Means in the
No.
marking, the UK is more malleable than the Irish. More
The Irish one
fastest.
examiner, no, Irish
Mm.
pass rate is higher, much higher than UK. Irish only one examiner is taking the decision. In the UK, you have 2 examiner in the station. One is foreigner and one is Arabic. The foreigner mostly better than the Arabic in the majority. Okay, the foreigner is, I mean, Western. So it depends. Sometimes one will give you satisfactory, other will give you borderline. Sometimes one give you satisfactory, other give you unsatisfactory. No one affect others. Everyone has his own judgment, and they will take the summation of the mark at the end. The pass mark in Irish, as you mentioned, 68 over 88. It changed sometimes, but in UK it's fixed 126. Okay. Then what is the important issues in the and mistakes they are doing usually in the stations? Now you enter the room with the examiner. The first, for example, you are in short case. You are doing general survey. Why you are doing general survey? For 30 seconds. Every mentor is telling do general survey, or in Boston doing general survey at least for 30 minutes. What is the idea?
But to see there is any, we can find any surrounding like wheelchair, any walking aids, any port for sputum, any oxygen
Yes.
mask. Right?
You are searching for clue. Okay.
To
I
guide.
will stop sharing this. Yes, you are searching for a clue, right? But what is happening in the exam? This is first mistake. What is happening in the exam? They are trying to show the examiner that you are searching for and looking, not only trying to pick. For example, last exam in abdomen, I was the examiner in the abdomen case, short. It was renal transplant, and I put beside the patient, I put the tacrolimus and mycophenolate in front of the patient on the cupboard, in very easy way to be seen. No one see it, only one see it. So this is very important. Sometimes the examiner try to help you by putting the clue. Charcot Marie, he will put foot orthosis, for example. They will give some medication, and so on. The other thing, while presenting the case, don't point on your body. This is also happened. The candidate is pointing, for example, the patient has hepatomegaly, looking. He's pointing his finger to his liver and then to his spleen. This is not good also. Okay? Other thing, being
معلش
afraid and hesitant.
the point you mentioned يعني telling the examiner the patient have يعني turning his head from the examiner to the patient or I didn't get
This
it.
is also, I will talk about this is not good also. For example, now I asked you, please doctor, present your case. Now it's between me and you. You look at me and you start present your case. Don't look to the patient because as if he is remembering why I am, why you are looking at the patient. Look at the examiner and start to tell to present the case. The other thing, he point by his finger toward himself. The candidate point toward himself that he has point to his liver that has hepatomegaly 4 centimeter below the right costal margin, and so on. This is not good also. Okay? Try to be presentable, confident. Don't be hesitant because, believe me, at the time of the examination, you reach the maximum knowledge, even maybe more than the examiner at the time. Okay? But because you are not confident and hesitant, and confused, you will be mentally blocked and you will not say anything. Even a simple question. For example, one case I asked about what you'll do for pneumonia. What you'll do for pneumonia? What is the simple imaging for pneumonia? Chest X-ray. He did not mention chest X-ray. Okay, so take care of this.
Sorry, Dr. Talat, just because I attended some on that YouTube, they are telling in front of the examiner, like if there is a scar in the abdomen of the patient, I will put my finger over it. And so the examiner will see that I picked this as a scar. You mean this is not good also?
No, not I'm talking about that. Now I am
Yes.
talking about the presentation. Now you finish your physical examination. Now 6 minutes past, start first question of the examiner, present your case, doctor. After presenting case, why you no need to look at the patient or point to yourself while presenting the case. You will present the case simply in front of the examiner looking at him. Okay? But while doing physical examination, okay, you can put your finger on the scar that you show that you see it. Okay, no problem for this.
Okay.
Okay. Okay. Any question? Anyone want to ask any question? Anything is not clear in this?
Dr. Talat, for the patient with transplant and with tacrolimus يعني I will catch the medication, see it, see the dose and like this.
No need for the dose, but at least if you pick
Yeah.
the medication, this will be a good sign, and it will be easy. You got the diagnosis. If you enter for a patient and there is a right iliac fossa scar or left iliac fossa scar, and you found this immunosuppressive therapy, you are dealing with the renal transplant patient. Why is this medication for the patient? You can ask, this is your medication. She will tell you yes. Okay, finish. Your case is done.
تمام.
Okay.
Doctor,
Anyone want to?
I'm about to ask you that, for example, when you're doing the examination, for example, can you ask a brief history while you're doing examination? For example, if you lost on the examination, can you
In short?
what's your in short, less than a
No,
minute for?
No, doctor. In short, you are only talking to the patient for instruction. For example, elevate your hand. I will do press on your tummy. I will put the stick on your chest. Only like this. No history at all. No history. 6 minutes, silent. Only asking for instruction. Do, for example, stretch your hand. You want to see for fine tremor. Stretch your hand. You want to see for bronchial drift. Only. Nothing else.
Sorry, Dr. Talat, if you see the candidate is hesitant, is it that will affect the marks?
100% والله 100%.
And if he's answering good, but he looks hesitant or not
If never, it's not
afraid.
it's not mostly they will not come together, the candidate hesitant and answering good. If hesitant, he will not answering good, because I will tell you something also, some examiner doing this. If I saw you hesitant, I will confirm from you, is this right or no? So now you are hesitant, you may change your words. You got the idea? So that's why try to be confident, even if you are wrong. Confident wrong better than hesitant right. Other questions?
This entrance this
Entrance.
is crowd circle. That it means I will not start with the station 1.
No,
May
it
I will enter
depends. For
station 3. Yes.
in every day there will be 3 session. Every session will take 2 hours. Okay. Then 5 candidates for every session. 5 candidates. So one will start in 1, other one will be in 2 and 3 and 4 and so on. So you may find yourself start from station 3 or station 4. So now station 4, you know, this will be communication and abdomen. After finishing the 20 minutes inside the station, you will go outside. They will guide you. There will be a guider. They will guide you to the other station, and you will sit in front of it for about 5 minutes. In talkative station like long clinical consultation or history, there will be the scenario will be in front of the room you will enter. You will sit on the chair and you will find the scenario. So you have to read it carefully, and you will given a white paper and a pencil and write. For example, in communication, especially because you will forget, write the patient name. You have to write your task. What you are. For example, you are in Dr. Ahmed, sorry, in acute emergency or in medical ward or whatever. And what is your task? Alhamdulillah, last diets, it will be written obviously. Discuss medical error with the patient. Discuss DNR with the patient before you depend on your understanding to the scenario. Last diets, it will be obviously, and you will start your scenario inside. Okay.
Dr. Tallat, for the long cases, outside we are sitting for 5 minutes. Do we have write down the differential diagnosis before entering the room on the paper, or no need to write the differential diagnosis before entering?
The white paper outside, you write everything, even if you want to write your approach. For example, my approach is first OCD, increase decrease association, and BDF SOSLES min, and this abbreviation. Or if you have time to write family history, sexual history, travel history, you write. No one will tell you what you are doing. No problem for this. White paper will be with you. They will not take it from you.
Sorry, I have heard from some mentors that sometimes the examiners say, give me your paper, I want to see what differential you wrote outside. Is it true?
In my examination, no one from me or my friends يعني face this. Okay. But even if this happen, for example, your case is jaundice. What you will put differential for jaundice?
We put hepatitis, viral
Yes,
hepatitis, then
at least you will put, yes, at least you will put pre-hepatic, hepatic, post-hepatic, and or pre-hepatic for hemolysis or for Gilbert syndrome, hepatic for hepatitis and cirrhosis and whatever hemochromatosis this disease, post-hepatic, for example, obstruction, obstructive jaundice, and so on. Okay, then you enter inside and you discover, okay, the jaundice related to another issue, for example, malaria. Okay, it will be okay related to the pre-hepatic, but what will affect if you did a wrong differential at the beginning? I cannot judge you. Okay, the fair, I cannot judge you from the simple scenario I gave to you outside, right?
Yes, yes.
Okay, Dr. Azhar.
Yes, yes. No, but my question is, some mentor told that the examiner will ask you, show me your differential, which you wrote outside.
Okay, if you show him your differential and it was different from the scenario, because the scenario will change. You
Yes,
got my point?
inside.
It's
Okay.
not fair. Yes, it will not be fair to judge you in your differential. You wrote outside by the a simple scenario I gave to you. I gave to you a hint. For example, referral of GB or patient to complain of coughing up blood. Coughing up blood, differential, a lot of differential. Maybe you bought TB, you bought malignancy, you bought, and it was Wagner granulomatosis at the end, for example. He did not give you other question you will ask inside. Okay.
Yeah. Yes.
Okay. Any other questions? Someone asked
Yes.
about the instrument. In Irish, you have to take all your instrument. In UK, mostly you find all the instrument inside.
Stethoscope, it will be with me in the UK. My stethoscope.
It's better to take your stethoscope if you are used to listen by it.
And also torch for ophthalmology.
Yes, only torch and stick better because no torch. But there is even in some centers you will find everything. But
Fundoscope
take
also
this
available.
at least. Take this at least. Okay. Because you may not find
Fundoscope is also available.
in Irish there is no fundoscopy. I think majority will offer fundoscopy. If he's not a good examiner, he will let you. So yeah, at least offer. I don't know, like if bad luck if he told you okay, do fundoscopy. Because it will take time. Fundoscopy, you have to close the light and so on, and patient should be prepared by pupil dilatation. So I think, inshallah, they will not ask about fundoscopy.
Inshallah.
Sensor examination in the neuro. What they will provide for this?
No, everything present. You will find for example, cotton. You will find this for pin brick. You will find vibration, tuning fork. You will find.
Okay. The cases is different daily, each day of the same
Yes,
center.
yes, different. Cases are different. Communication come from the UK and centers. The short cases according to the center, but it will be repeated. So it's a good idea for you to check what short cases come in Egypt. You got my point. Every center there is some short cases they are putting regularly, but the long case may change because this also scenario sometimes come from outside or sometimes from the who are responsible for the examination in the center in the country. Okay, any other questions anyone want to ask?
In the long case, there will be relative besides the patient.
In
Sometimes.
long case, not sometimes, always. In long case, there will be the patient with finding, and there will be one, mostly his medical doctor. This will take history from him because you will speak in English, okay? And don't depend on that. This one you are asking, he will give you typical scenario what you are practicing with your friend or any mentor you see, because majority of them asking is reading the scenario mostly. Concentrate with me for this point because this is very important. This doctor, small young doctor, he will read the scenario mostly 13 minutes before the exam. Okay, so he pick what he can pick. That's why most of answers will be I'm not sure or I don't know. So try take care of this. Very important. In Irish, there is no patient, real patient. In long, it will be a surrogate, and he will be a medical doctor. Junior doctor will be simulating that he is a patient. Also, exactly like this. 30 minutes before the examination, they will give him the scenario. He will read it, and he will pick the scenario, what he will answer, what he has, medication list, and these things.
Dr. Tallat, for example, if we are in Pakistan, the patient has a local language. Then he cannot talk with English. So there will be surrogate for the history?
He will not be surrogate. There will be a collateral beside him. He will be a doctor. They will give him the scenario, for example, a case of rheumatoid arthritis. Okay, they will give you one doctor. He will simulate he is the son of the patient. Talk to him. So you will start talking to him in English, and he know everything he will ask about, because there is something called calibration. This is in the hand of the examiner. For example, I have a calibration now for this case. Dr. Azhar should ask about, for example, family history for this patient, because I suspect there is autosomal dominant and there is a similar condition. He should ask, for example, a sexual history, because there is weight loss and high temperature and loss of appetite and suspect HIV, or so on. If you do not other questions, I mean, it's mandatory to ask this question or you will be affected. It's allowed to you to increase the questions, but it's not allowed to omit one of these important questions. You got the idea?
Yes.
Any other questions?
Yes, and during examination, we are dealing with the patient. And with the patient, we can talk with the local language.
Yes, but what is talking with the patient? Only instructions. Only instructions.
Yes.
Elevate your leg, open show me your feet like this. Only.
Can you sit down? Can you walk for me like this?
Yes, only you can talk this, but it's better because he will not understand. But if you can ask about this question also for the examiner, try to be cautious, because you don't know the mind of the examiner. So you can ask the examiner, can I give him instruction in local language, or you will give the instruction in English and the surrogate beside him, the collateral, he will translate. You got the idea? Don't put yourself at the imagination of the examiner. Any other questions?
So Dr. Talat, while I will do a maneuver for the patient, like I will take permission for examination of the chest, or I will tell him, if you have any pain, you can stop me, or something like that one. I will tell this in the local language, or I will tell in the English. This is also because it will take time if I will repeat it for English
In
for
short,
the examiner, and
in
for
short,
the Arabic for the.
No, Dr. Ahmed, I got your question. In short station, you are dealing with a patient who is mostly from local area. So you talk in Arabic, no problem for this. Okay? But I'm
Okay.
talking in translation. This is in long clinical consultation. You are supposed to be in UK or in Ireland. You are talking English for the patient. So why, for example, why you are taking history in Arabic? This is for history and for managing a patient concern and a lot of skills in this area. But physical examination, you want to ask the patient to do something, so give him in local language, no problem. Okay. Any other questions? Any other questions in the
In the case, it means there is two examiners. Mostly one will be local, so that he will understand that I spoke in Arabic with the patient, isn't it?
Sorry again, doctor, because I was reading the comment one is writing. What is the question?
In the case, there will be two examiners.
Yes.
Okay. One of them, I think, will be local and the other foreigner. So he will understand that I spoke in Arabic with the patient, what I told him. Because if I told him, if there is pain, you can stop me. If I told him in Arabic, may the foreigner examiner will not get my point or understand what I told the patient.
The examiner wants from you two things. He want from you in short station. He want to see you do the physical examination correctly, and then tell him the sign correctly. If you talk to him in whatever language you want to ask for instruction, this is not his headache. He wants this only. But in long clinical consultation, a different area, because you are not talking to the patient, you will talk to another one. ask any question you want to ask, because at least now you will go to the examination, you know the idea, how you are moving, how you are sitting for the rest, for how long, how you will use your time, reading the scenario twice, writing in your white paper the most important things. You know how the skill is, okay? Start, because the beginning is very important. If you get confused from the beginning, you may lose the exam. Remember that you are practicing all these months for only 2 hours. You should be prepared well for these 2 hours. 2 hours will decide your future. You get the point. Very, very important and very risky. 2 hours if you are not okay, 2 hours if you are not good, 2 hours if you are not confident, either you will pass or you will fail. Inshallah, all you will pass. But try to be calm in this day. Sleep well, and this is very important. So any question related to the exam date, ask me today. I did not get your point, Dr. Ibrahim. What is the exam medical device?
Doctor, in long clinical consultation,
If you
when-
allow me, Dr. Talat, we already have pre-meeting before the exam, and the examiner or the head of examiner, they will tell you the instruction, and at this time we ask them if we can instruct the patient in Arabic, and they allow us about that. Other things we ask them about the watch, if we wear it in our
Yes.
hand, and the other
Excellent.
things like
Excellent.
it is a
Yes,
must
doctor.
to making our sleeves up or no, and these things they allowed us. So I think it is also better if someone will make like that. So in you are will in short cases or in long station, you will tell the patient in Arabic the instructions that you want, and no problem that the foreigner will not understand. The Arabic understand what you said.
Dr. Aisha, yes, excellent point, Dr. Aisha. Yeah, as mentioned, Dr. Aisha, there will be pre-meeting by the convener who's responsible, coordinator for this exam. He explained to you this small point. You can ask about this small point, and he will tell you. They will tell you it's allowed. Okay, no problem. It will be allowed to ask in your own language. Okay. Another doctor was asking. Dr. Huda will take history are looking to the collateral surrogate.
دكتور طلعت، هو في الشورت كيسز ما بكتبش الفايندنج في ورقه، ولا you are not writing the finding in a paper like the long consultation, just
No.
from the memo for examine the patient?
No, in short, you are not. You have no paper. In long, you have paper, but you are not writing the finding. For Dr. Huda, no, Dr. Huda, you are talking to the collateral, the medical student who is sitting. They will tell you take history from this. I can talk. Maybe you received me as I saw written. I don't know what might be was big tube. I don't understand, Dr. Ibrahim, your previous question. You told me examine medical device. You mean if the patient for Crohn's and he do some big tube for this motor neuron disease and there is big tube or something, he want you to examine it? This is your question or what? I did not restrict you. You do unmute and you can talk. You press on the microphone, doctor, and you do unmute.
Assalamu alaikum.
Alaikum assalam wa rahmatullah.
Doctor, I see the instructions in the website, and they said you might in miscellaneous station expected to find a medical device, and the examiner will ask you to check this device and then examine the patient and related to this device. I didn't know what's the device, but The guide is present, and I might send it in the WhatsApp.
In short station, Doctor, in Irish, you are talking about Irish, right?
Yes, miscellaneous station. You say they said.
Okay, in this station there is either Indo or miscellaneous. Indo or miscellaneous. If you check recall for the last even 7 years, you will never find any examination of medical device. It will be mostly miscellaneous because they will bring this rheumatological disease. Okay, Indo, for example, maybe acromegaly. There is some cases acromegaly. Miscellaneous to bring, for example, ankylosing spondylitis, rheumatoid arthritis, systemic sclerosis, Graves' disease, and so on. These are the most common. Common is common. But if he, as you said, medical device like this, maybe there is some like big tube, like something. But I have never seen this, or if even I don't see anyone recall that came in his examination, examine this medical device. Okay, so don't be worried about this point.
Okay, thank you very much.
Okay, Dr. Ibrahim, passmark in Irish is very good, more than 70%, and the most examiners are good in Irish. So don't be afraid. If you fail the exam in Irish, definitely you are not prepared well in Irish. But in UK there is another some things in UK is a little bit different and difficult also.
I hope.
I mean,
Allah.
yes, I mean a very good candidate in UK, they may not fail because the examiner as what he see. And in the station there is two examiner. One is leader of the examiner who is asking, and the other one is only observing. And depends on if one affects the opinion of the other, they may agree that you will take unsatisfactory, for example, and you will lose the skill, and definitely you will lose the exam. And the majority of candidates who did not pass in UK, mostly 1 or 2 mark in one skill, mostly. Any other questions?
Sorry, Dr. Talat, in the short case like cardiology, for example, if I'm not sure of the murmur that I hear, yeah, it means I will fail this station, or if it is
There is
mid-diastolic or pansystolic,
no,
and I told that there is abnormal heart sound murmur, and I have not told it is either mid-diastolic or pansystolic or like that one. It means that I will fail, or I will give me borderline.
there is many questions answered by every examiner because this is examiner wise. What the examiner will see, if he sees that all the, for example, you did well in the majority but only this missed, he may make it borderline, for example. But abnormal heartbeat, but I don't know is murmur or no, this is not good. You are not sure, you are hesitant. Okay, you did not mention the name. If it's near, okay, for example, it was early diastolic and you said mid diastolic, even in the same area, it may be. But early diastolic and you said mid diastolic. But if you did not mention, it depends on the examiner. Wallahi, no one can tell what the examiner will say. Sometimes the examiner, you may do a small mistake, he will give you unsatisfactory. You got the idea. No one can answer this question. This is examiner wise, according to the examiner himself. Okay, any other questions? Ask any question now, because we will go for practice and no time to again open this area.
In cardio station, our examination technique is very good, but we are not sure about the murmur. So I can say that there is a one murmur, but I'm not sure whether it is systolic or diastolic. So what will be the situation?
It will. This is the same question of Dr. Ahmed. This will definitely depend on the examiner at the time. Yes, I cannot say what he will give you. Physical examination, we mentioned, I can give you 88 mark, as we mentioned, by some patient concern, examination technique good, and so on, and will fair. But here now we said identifying physical sign This is the most important and the most dangerous risk skill. Why? Because this will decide what will go after. If you start right, you will go right. If you start wrong, definitely you will go wrong. And the majority of candidates, if you see the pass mark and the fail mark, the majority in identifying physical sign are failing this skill. Identifying physical sign. That's why it's very important to train yourself to not only to do examination. You do examination, okay, to do the technique, but then to elicit the sign, you have to know this is fine course, this is fine crepitation, this is coarse crepitation, this is wheeze, there is hepatomegaly, and to how to measure the span of the liver, and so on. Okay. Any other questions?
Another question, Dr. Talat, for for the long consultation. يعني if I did well in the history taking in the examination and answering all concern of the patient, but didn't reach the diagnosis or put it in the list in the يعني the bottom of differential diagnosis.
If it's straightforward and easy case, for
I
example,
will
case
fail
of
the
rheumatology,
station.
not the station, the skill. Now, for example, you did a very good history, equal 4 mark. You did a very good examination, 4 mark. You did managing patient concern, very good. This is 4 mark. Now 12. You did patient welfare good, maintain it by inspection and so on. Now 16. Now you are 16. Now then you will go to your question. You did not mention the diagnosis. If he's aggressive or the case straightforward and easy, after this, he will give you 0, unsatisfactory. Then if you did not, this is the question also, if you do not give the differential diagnosis, okay, clinical judgment mostly will be wrong also, because you said, for example, this is systemic sclerosis, and it's another issue before, away from rheumatology. So how you will treat, for example, the case systemic sclerosis, and you said this is TB, different approach in management plan, right?
Okay.
You got this point? You got this point?
Yes, thank you.
Yes, if the case is very difficult, at least you will put, or you need some, for example, the patient came with epigastric pain. You cannot say what is epigastric pain, right? Chronic pancreatitis, maybe MI, a lot of differential. You don't have ultrasound, you don't have CT, you don't have ECG now, you don't have any lab for troponin or amylase or lipase or nothing. And the questions, okay, and you got confused. There is some answers of the question of the patient lead you to pancreatitis. Some also guide you for heart disease. Okay, so you will put now differential diagnosis. If the patient and the case is difficult, it's allowed to, but at least you should put the correct diagnosis in the list of differential diagnosis. You got the idea?
Yes. Thank you.
Dr. Talla, sometimes we are saying I will use steroid and steroid sparing agent. We have to mention specifically which steroid sparing agent, methotrexate, cyclosporin, cyclophosphamide, like this. If we will not mention, they will cut mark.
For what? For example, give me an example. A case patient will take steroid.
There is a case of dermatomyositis. We will start with treatment with the steroid, and after then we can use steroid sparing agent. So we have to mention what will be the names of steroid sparing agent, methotrexate, cyclosporin, like this.
These fine points, Dr. Azhar, depends on every examiner from other one. Some examiners are very aggressive, some are very good. This is a wide variation in this area. Some he wants you to mention everything, okay? Yeah. Even if it's not specific. Some he, for example, Crohn's disease, and you did not mention erythromanodosum, for example. Is it specific? It's occur in many diseases, but some examiner he see you should, for example, in Irish, for example, and the case is surrogate and the Crohn's disease, and he did not examine or search for erythromanodosum. He may tell that this erythromanodosum is an important sign. You should mention it. Some others, okay, no problem. He ask about everything in the joint pain, abdominal pain, and if there is any blood back from his passage, and all the other questions. He will pass it. This is examiner wise also.
Luck is very important.
Luck is very important. Luck is very important in your examiners and in your in their perception also. Another thing is very important. They are taking an impression from you from the beginning. This is very important. This affect if you are start good and do some mistakes in the middle, he may see it because of anxiety and so on. But if you start wrong, wallahi, he took a bad impression on you that you are wrong. It's not easy to be corrected. Any other one want to ask?
Hello. I want to ask, in the exam, in the long case, there is very less time, and sometimes the cases can be very diverse, like autoimmune or Men's syndromes. You said that they give a paper and a pen outside. So can we take that when we have that paper and pen inside? Can we jot down the main points when we are taking the history? Is it allowed, or do they take the paper away? And is this helpful? Will this be like helpful if we try to do this, because sometimes we forget what the patient said in anxiety, or we tend to forget important things which should be mentioned at the end. Can we do that?
You mean to write what is the positive finding or what is you are getting from the patient?
Yeah, for example, in history he mentioned something. It feels like, though there are only 6 minutes, like when we are sort of summarizing the case, we might forget. Or for example, when we have diverse symptoms, like in autoimmune, there might be a symptom from the abdomen, one from the respiratory. If while the patient or the cell surrogate is speaking, we jot down the important points, and then when we look at the paper, and we can connect and make a differential diagnosis. Will this be helpful in only 6 minutes to sort of jot down the important points in history? And will we have that time there, or it's better not to do it?
I got your point. If you are practicing well and a lot before the exam, you will not need to fill in this paper. Why? Because writing down in the paper, it will take time also. You will ask and take time, and you will definitely you will stop for seconds to write down. So this will not be a good in front of the examiner. Okay?
Okay. All right.
If you are,
Thank
yes, if you are practicing more and more and more, believe me, you will not find, you will not forget this positive finding. And when he tell you present your finding, don't mention negative finding, only positive finding. The patient has joint pain, he has stiffness in his back, he has redness in his eye, and he has shortness of breath. You are asking, and these are the positive finding. At the end, you are putting these positive findings together, and mostly, for example, ankylosing spondylitis or whatever. You got the idea? It will be like this.
Okay, so it's better to practice a lot.
Yes, and better to avoid writing down because it also will take some time.
Yes.
Two important point in history. Repeating the same sentence of the patient will double the time. For example, he told you, you asked him, "Did you travel recently?" "Yes, I traveled to Pakistan." For example, "Yes, you traveled to Pakistan." Some candidate do like this. He is repeating the same sentence the patient is saying. This will take time. Your time is limited. The other point also, writing down in your paper will take time and will give impression for the examiner that you are not. You have to be a good memory doctor. Just what he's telling to you now, you are completely completely concentrating with the patient. What he's telling you, you are memorizing. Okay.
Okay. All right. Thank you.
Thank you, doctor. Any other questions?
آخر سؤال يا دكتور طلعت،
اتفضل.
بالنسبة للكرايتيريا بتاعت for criteria of passing Irish said 3 you can see from the 5 short cases. يعني communication محسوب معاهم ولا لازم is included or
Yes.
I
Included,
must
doctor.
pass
Included. Three short abdomen. Okay. As wait, doctor, I will unmute. Okay. Okay, doctor. So criteria 1 long, okay, from the 2, and 3 from the 5 short, including the communication. I did unmute. I did mute for all because of the voice. If you want to talk, unmute.
Okay. يعني 3 short must to pass the communication in the
3 short, including the communication. For example, you passed the communication plus abdomen plus neuro, and 1 long, and you did not fail any skill. Congratulations, you passed.
inshallah. Okay, thank you, Dr. Talat.
Dr. Karim,
Okay.
I don't know about the age, but it's a very good that you are 65 and you still continue to try to finish this exam. Appreciate this, wallahi, very good. MashaAllah. Any other questions?
دكتور بالنسبة لللبس مقيد إنك تكون لابس سكراب ولا فوت؟
No. If you want to lab coat, okay. If you are with a scrub, okay. If with any other clothes, it's okay also. Doctora asked about 1 month and 3 weeks. Good for exam. It depends on your basic. This is first point, and the other thing for your practice. Because if now you have 7 weeks, I think if you start from tomorrow, but seriously, and you are have a good basic, inshallah you will pass, doctor. Very important not to miss the chance also, doctora, because finding a seat, this in itself need the congratulation to find a seat in UK examination. So you don't know if you leave this chance when you will get another seat and what will your condition at that time. So inshallah, try to do seriously and well, and inshallah you will pass. Any other questions?
السلام عليكم.
عليكم السلام ورحمة الله.
دكتور في موقع، معلش أنا بتكلم عربي، في موقع نفس الشيء في الشهادات بتاع RCPI إنه لازم تلبس نص كم. هل ما زال الشيء هذا موجود؟ يعني ما يكونش عندك كم، ما يكونش حتى لابس ساعة يعني.
Okay, Dr. Ibrahim asked about the clothes. It should be have sleeve. Wallahi, Dr. Ibrahim, in UK, no problem for this. In Irish, no problem. Long sleeve can be. In UK, even I was wearing a smartwatch. No one told me anything. This is what happened to me. But as you said, try to be cautious. No problem. They wear half sleeve in UK if you are in UK, and classic watch also.
أنا Irish طبعا.
In Irish, no one will talk about this. In Irish, you are focusing in your examination and your approach. We are benign, يا دكتور. Don't be afraid. Any other questions?
هل مسموح أكون لابسة ساعة في يدي؟
You can wear a classic watch because if there is a pulse, what you will do? If you in cardio case and you want to check the pulse, what you will do? So you can put it. Majority of candidates they are putting in the trouser in the belt. These things also, as mentioned, Dr. Aisha, you can in the pre-meetings you can ask about all these things because it depends on the coordinator at the time. He may say that you no, don't wear this or put it, no problem if you put in your hand. So no problem, it will be. Any questions? Any further questions? If no more questions, we will. Okay.
دكتور
Okay, thank you. If no more questions, so we will end this meeting. Okay.
Thank you very much, Dr. Talal. Thank you very much.
Okay, thank you. Assalamu alaikum wa rahmatullah.
وعليكم السلام ورحمة
وعليكم
الله
السلام.
وبركاته.
Thank you, Dr. Talat, very much.
جزاك الله خير يا
ورحمة
دكتور.
الله وبركاته. شكرا دكتور.
شكرا جزيلا.
Thank you. Thank you.